Hello and welcome to Rise Unwind. My name is Dan. You know, each and every week we talk to people from across the country about things you can do right here in your neighborhood. And on this week's show, we got this.
Meanwhile, our guys being in the military are traveling all over the world, getting all these cool and awesome experiences. We wanted to slice of that pie too.
All of that and more right here on Rise and Unwind. Tailgating season is officially here, and if your game day snacks could use a little upgrade, this next guest has got you covered. He's a Food Network favorite and entertaining expert who knows how to turn any table into a touchdown spread. Joining us is Chef George Duran with tips to make your game day food easy. Welcome to the show, Chef. How are you, my friend?
Thanks for having me on, Dan. Really appreciate it.
All right, game day food is all about fun. How'd you make a tailgate spread stand out while keeping it easy to prepare, my friend?
Hey, you know, one of the easiest ways to make a game day spread stand out, like you said, it's with cheese. It's a versatile, indulgent, and instantly elevates any dish when tailgating without the complicated prep. So for tailgating, this President Grilled Brie is one of my absolute favorites to serve. So simple, so delicious. You just add your Brie in a skillet and cut some cross hatches on it. Then add some fruits like apples, pistachios, drizzle it with honey. You can even use seasonal fruits and ingredients. And if you love pumpkins, well, you're going to love it with pumpkin puree as well. Walnuts, drizzled honey. Once it's all put together on that skillet, you pop it onto your grill when you're tailgating in the stadium parking lot, or even in the oven at home, and serve it with crostini, baguette slices for an ooey gooey sensation. You really can't be shy about this. This hot Brie is a must try.
And you've partnered with President Cheese for this. What are some of your favorite ways to use bold, flavorful cheeses in those fan favorite dishes?
Yeah, I absolutely love President's Pub Cheese Sharp Cheddar Spread. It's a whipped and creamy cheddar spread made with 9-month aged cheddar, and it's bold in flavor, perfect for game day snacking, dips, and it melts beautifully. I even love serving this cheese warmed and drizzled over nachos, or you can even turn it into a taco nacho board, if you can say that properly. You could truly impress your guests with that. But the beauty of this pub cheese is its high quality and versatility. You can spread it directly onto mouth-watering sliders to create a rich, velvety layer that melts into the meat and ties in perfectly with every bite together. Creamy, flavorful, a crave-worthy crowd pleaser. What's not to love?
All right, so what are your favorite go-to tricks for making entertainment stress-free when the crowd pretty much shows up hungry?
You know, like I always say, cheese is always my go-to for game day. It adds richness and brings everything on the table together. It also pairs perfectly on a charcuterie board that your crowd can pick on before, during the game. It's also important to balance temperature with your cheese. That means keeping baked or melted cheeses under gentle warmth. You can, for example, use insulated dishes or a foil tent to work wonders doing that. Managing temperatures this way keeps everything tasting relatively freshly made without babysitting at a parking lot or in your home, of course.
Do you have any creative twists you recommend to take that classic tailgate snack to pretty much the next level?
Yeah, what you want to do is always pair your cheeses, particularly Brie, for example, with something sweet. So take your favorite jams or anything you have in your fridge or in your cupboard that's sweet, maple syrup, hot honey, jams and preserves, pair it with a cheese, and you are golden. You are set to go. Just put it on it, melt it, or just leave it as is. And just when you put those two together, sweet and savory, oh, it's heaven.
And finally, where can our viewers go to find more inspirations or game day recipes and entertainment ideas?
Yeah, you can find all this and more at PresidentCheese.com, and you can find President Cheese at stores all around you.
Chef George Duran, thanks for joining me today.
Thank you. Happy game day.
With travel prices on the rise, more families are looking for ways to plan affordable getaways. And that includes military families who face unique challenges when it comes to taking time off. Joining us today are Jen and Kirst, military spouses and co-founders of the blog Wives of the Armed Forces. They're here to share how they make travel possible and affordable for families across the country. Welcome to the show, you two. How are you?
Thanks for having us, Dan. We're doing great.
All right, what first inspired you both to start sharing your travel experiences and advice with other military families?
Absolutely. So whenever we first got married to our husbands, and then they're actually the ones who introduced us, we found out really quickly that there was a lot about military life online that we just did not see to be true for us. While there's a lot of hardships that we deal with, there's also a lot of opportunity, both personally, professionally, and in ways like travel. And so we just wanted to spread some of that news and be more encouraging to the military spouse space, which is why we started Wives of the Armed Forces. But when it comes to travel, we found out that travel and military life, they really just go hand in hand. Like I said, when we both got married to our husbands, we were fresh out of college, person just out of grad school, moved thousands of miles away from family, and found out very quickly that it was painful that we had to constantly be using all of our vacation days and dollars just to go back home to see family. Meanwhile, our guys being in the military are traveling all over the world, getting all these cool and awesome experiences. We wanted a slice of that pie too, and we wanted to share it with our loved ones. So the best case scenario that we have found is when we can meet with our family halfway or at a cool location. One thing that my family and I loved doing was when I was stationed at Washington State, there in the South, and we met in the Canadian Rockies and just had the best time.
And travel costs, they keep going up. How is that changing the way families are planning their vacations?
Well, I'll tell you, military families are always used to managing hardships when they do pretty much anything in life. So travel costs are nothing new to us. We're having to manage a lot of logistics already just to make travel happen. It starts with leave and being able to get the time off. Sometimes you get it right away. Sometimes you're competing with other people in your unit or your squadron to try to get it. So that makes it a little bit of a challenge. We're also then trying to work around our kids' schedules, our extended family schedules, so that we can see the loved ones that are so far away. And then in addition to that, we're always thinking of our budget. We want to make sure that our dollar is going the furthest that it possibly can. So we're used to being creative and using the resources around us to try to make that dollar stretch as far as we possibly can so that we can get the best of both worlds.
Why do you feel that travel planning is especially tough for military families compared to some of the civilians?
A message that we want to get out there is that for you to support the military loved ones in your life, you can make them feel so seen by being open to traveling to them, or like we were saying, meeting them somewhere. There's awesome resources out there like Armed Forces Vacation Club that has stunning locations around the US, also worldwide, but the ones here in the US are just really affordable to get to and to stay at, and they often can accommodate larger families. And it's just a great solution for these military families and their extended loved ones to come together.
And what are some of your best budget-friendly tips for families trying to save on trips right now?
Oh my gosh, it's so hard to decide where to start. I think the biggest one, kind of piggybacking off what Jen was just saying, is flexibility. And that's flexibility from the military side of the house and then also from your civilian family members. Traveling during off-peak times is ideal because it also mitigates that leave issue we were talking about earlier, as well as offsets the cost. It's a lot less expensive if you're not going during a peak season. Another big one that we love to recommend is using credit card perks to try to drive down the cost for airline travel. You can oftentimes take those points, transfer them to your favorite airline, and then hopefully travel for free. And then like Jen was talking about with Armed Forces Vacation Club, there's a free membership that you can get. You don't have to pay anything, but you get the discounts, and taking advantage of those types of opportunities are huge. Right now, they're doing a Veterans Day sale that you can stay for 7 nights at a resort for $329, which is absolutely insane. And the types of opportunities we want to encourage military families to jump on.
And finally, where can our viewers go to find more of your travel advice, maybe learn about the resources you recommended? Maybe that's Armed Forces Vacation Club. That sounds cool.
Yeah, absolutely. For Armed Forces Vacation Club, you can find them and all of their information at afvclub.com. I personally like to sort by location, but they also have everything sorted by their promos that they're currently running. They're also sharing those on their Instagram and Facebook. For us, you can find more about Wise of the Armed Forces at our Instagram, Wise of the Armed Forces. We're also basically anywhere else online, but we're just a community of military spouses who've come together to encourage and empower each other and share resources like this.
I really want to thank you two for joining me this morning.
Thank you.
Dan.
Do you ever feel overwhelmed trying to make sense of Medicare options? You know, every fall, millions of Americans get a short window to review their coverage. And this year brings some important changes that can save money and expand your benefits. So joining us is John Jackson, Director of Care Plus Health Plans, to help make sense of Medicare's annual enrollment period and what's new for 2026. Welcome to the show, John. How are you, my friend?
I'm doing well. Thank you for having me. Excited to be here with you.
All right, can you explain to us what is the Medicare annual enrollment period and what does that mean for people with Medicare?
Absolutely. So the Medicare annual enrollment period, first and foremost, it goes October 15th until December 7th. This is the time where Medicare beneficiaries have an opportunity to change their plan for the new year. It's extremely, extremely important for you to think about your healthcare needs, think about what's important to you, and make the best decision during this time period.
And can you break down some of the main types of Medicare plans? How do they differ?
Absolutely. So there are two main ways that individuals can get their Medicare coverage. The first way I'll mention is Original Medicare. So Original Medicare is offered from the government. It consists of two parts, Part A and Part B. Part A covers hospitalization, Part B covers medical services. You can add a separate Part D drug plan if need be. And typically with Original Medicare, you can visit any doctor or any hospital that accepts Medicare. The second option or the second way is the Medicare Advantage program, commonly referred to as Part C and offered by companies like Care Plus. With a Medicare Advantage plan, you'd receive all the benefits of Original Medicare and additional benefits like dental, vision, prescription drug. Typically with Medicare Advantage plans, your service providers would have to be within the plan's network.
And when people are looking at reviewing their coverage or maybe even switching plans, what are some of the key things people should be thinking about?
That's a great question. Think about healthcare needs. Think about services that are really important to you, such as dental, vision, hearing, prescription drug. I'd also encourage individuals to think about their preferred doctors, hospitals, pharmacies that they like to go to. And then think about costs, deductibles, copays, coinsurance, maximum out of pocket, and think about different benefits and services that may be offered by specific plans.
And are there any major Medicare changes that are coming to 2026 that we should be knowing about?
Absolutely. There's several important updates coming to Medicare that everyone should be aware of. I'll start with the prescription drug coverage changes. The annual out-of-pocket maximum for Part D drugs will be capped at $2,100 starting next year. There's also some key changes from the Inflation Reduction Act that remain in place, including insulin costs being limited to $35 per month and a zero copay for recommended Part D vaccines. There's also some new rules being introduced to speed up the approval process, making medical treatments easier for beneficiaries. And the last thing I'll mention in terms of changes with Medicare Advantage, supplemental benefits like food assistance, transportation, home support, there are some eligibility requirements that have changed. So it's really important that you review your plan's benefit details.
So how are you guys at Care Plus helping people navigate these updates and maybe compare their options?
So we provide educational resources. We are hosting events out in the community. We actually provide educational material in multiple languages, including English, Spanish, and Creole. You also can call a licensed Care Plus sales agent if you need help. We can help you right over the phone or in person with an in-person appointment. Last thing I'll mention is Care Plus also has a partnership with the Department of Children and Family, and it allows us to help everyone, not just our Care Plus members. We have the ability to help individuals apply for Medicaid as well as SNAP assistance and check different Medicaid eligibilities.
All right. And finally, where can our viewers go for more information? Maybe check out some of these Medicare plans and benefits.
So beneficiaries can visit the official government website, at medicare.gov, or you can visit the Care Plus website at careplushealthplans.com. And individuals can also give us a call directly at 1-855-450-1352. TTY users can call 711.
I want to thank you for joining me this morning.
It's a pleasure. Thank you again for having me.
Ever think about how much strength it takes for the tiniest babies to fight their way into the world? November is Prematurity Awareness Month, and it's a moment to honor those little fighters and the families and caregivers who support them every step of the way. Dr. Diana Patel is a board-certified pediatrician and mom of two, here to help us understand why caring for premature babies is so specialized that even their diapers are made with extra intention. Have a look.
Each year, more than 360,000 babies are born too soon, representing about 10.4% of all births nationwide. For families, it's an incredibly emotional journey. Caring for premature babies is incredibly specialized, and even something as simple as a diaper has to be completely reimagined. Pampers is behind every baby, even the tiniest fighters, which is why they created the world's tiniest diaper. Pampers Swaddlers size extra, extra small, designed to provide care and comfort for the most vulnerable babies born prematurely, weighing less than 1.1 pounds. Pampers is the #1 choice of NICU professionals and the first brand to partner with NICUs and create a preemie diaper. Each diaper in Pampers Preemie collection is designed for extremely premature skin and is made with premium soft materials to help prevent abrasion of babies' underdeveloped skin. For over 25 years, Pampers has partnered with March of Dimes, a national organization dedicated to improving the health of mothers and babies. This November, during Prematurity Awareness Month, Pampers is continuing its commitment to the advancement of care for the most vulnerable babies with a donation to the March of Dimes NICU Family Support Program. This program provides education, comfort, and life-changing guidance for more than 50,000 families each year as they navigate the challenges of a newborn stay in the NICU. Visit pampers.com to learn more about how you can support preemie care with a donation to March of Dimes this month.
Ever wonder why finding good childcare feels tougher than ever? Families everywhere are juggling long wait lists and rising costs. And a new report shows millions of kids still don't have access to reliable early education. Today, we're digging into how high-quality programs can make a real difference in a child's development and in a parent's daily life. So joining us is Darren Harris, CEO of Goddard Systems. You know, the team behind Goddard School and its inquiry-driven wonder of learning approach. Welcome to the show, Darren. How are you?
Doing great today. How about you?
I'm doing good. Okay, well, why is access to high-quality childcare and early child education so critical for families right now?
Well, it's essential. Early childhood education is critical in helping children build confidence, empathy, and curiosity right from the start. And for parents, it's what helps them balance work and family. Today, more than 4 million children in the U.S. lack reasonable access to childcare, costing our economy an estimated $200 billion over the next decade. So when we invest in high quality early education, we're not just supporting children, we're strengthening families, we're helping communities and our economy.
So how is the Goddard School stepping up to meet the growing demand for reliable childcare and early learning programs?
We're going to grow where families need us most, one trusted community related school at a time. Each Goddard school is locally owned by franchisees who know and care about their communities. We have 9 schools today in the Tampa market. And so by empowering local educators and entrepreneurs, we're building a stronger, more reliable child care network.
So what do you feel makes your approach to early childhood education stand out from others that are out there?
Well, we have an exclusive Wonder of Learning program that blends inquiry-based learning with play. It's focused on allowing our teachers to guide and spark a lifelong love of learning. So through hands-on exploration, children get to ask questions, they get to discover answers, and really try to grow academically, socially, and emotionally, which ultimately leads to building that confidence and a lifelong love of learning.
So how does the Wonder of Learning program help build confidence, curiosity, and overall growth in young kids?
Yeah, well, Wonder of Learning is a program that turns every why into discovery. So teachers guide hands-on experiences that help children think critically, they get to solve problems, and they get to express themselves. So, for example, instead of maybe just giving a kid a recipe, a teacher might ask, how do you think we make lemonade? And the children get a chance to engage in serve and return dialogue where they explore, experiment, and learn together. You then may ask a follow-up question like, well, how many lemons do we need? And how do we make it sweeter? So it really encourages experimentation and engagement from both the entire classroom and the teacher.
And what is Goddard's Family Appreciation Week, and what does that mean for the families you serve, and why is it important to highlight them?
Well, during this week of Thanksgiving, it's the perfect week for us to have our Goddard Family Appreciation Week. It's our chance to say thank you to the families who make our schools so special. It's about celebrating that partnership between parents and educators. So when families and teachers get a chance to work together, we know that children flourish, and that's a wonderful thing. And it happens both in and beyond the classroom. It's part of our core beliefs here at the Goddard School that learning doesn't just stop at our door. It happens beyond our classroom where those families connect and continue it at home.
And for anyone that is interested in learning more or maybe finding a school near them, where could they go?
So visit goddardschool.com. You can explore our approach. You can find a school near you. We have 3 schools coming soon beyond our 9 in the Tampa market. And you can explore expert tips on how to be a better parent. I think we could all use that. And for those interested in opening a school and owning one in your community, visit goddardschoolfranchise.com.
Hey, I want to thank you for joining me this morning.
Thank you, Dan. Have a great day.
There's been a lot of conversation around GLP-1 medications for weight management, and not all versions come through the same channels. Some people are turning to compounded versions when their insurance don't cover some of these prescriptions. So joining us to help unpack what that means and what questions consumers should be asking is Dr. Angela Fitch, past president of the Obesity Medicine Association. Welcome to the show, doctor. How are you?
Thanks for having me, Dan.
All right, so I've been hearing that there might be risks when coming to compounded GLP-1 medications. Can you tell us about them?
Well, the compounded GLP-1 medications are not the same as the original FDA-approved versions. Compounded versions do not go through rigorous safety, efficacy, or quality testing. And this is a concern as it relates to millions of Americans that are undertreated for the disease of obesity and, frankly, being taken advantage of sometimes, thinking that their medication is the same thing.
So why is insurance coverage such a critical factor in getting access to some of these treatments?
Well, obesity as a chronic disease has never really been covered like other chronic diseases. You don't think about your high blood pressure or your diabetes or even your cancer for that matter, going online to get a medication that you don't know where it's coming from or what the quality is of that medication. Typically, we're going to our doctor and we're treating a chronic disease as it is, as a chronic condition, and we're getting medication prescribed to us. And that's what we hope to see for the disease of obesity moving forward. Last week, a pivotal thing happened in that Medicare is now able to cover these medications for obesity as of next year. And because Medicare never covered it, a lot of commercial plans say they weren't going to cover it either because Medicare didn't. Now that Medicare is able to cover it next year, our hope is that more commercial plans will follow so that millions of Americans can get access to a safe and effective FDA-approved obesity treatment.
And do you think regulators and policymakers are doing enough to protect patients? And what steps do you think they should be taking?
Well, I think it's time that we end this mass compounding that's been happening. Compounding is a valid technique used to create personalized doses for individual people. It was never meant to be used at the mass compounding level unless there was a shortage. And the shortage is now over of these medications and the prices are coming down. Next year, we're hoping to have official oral versions of these medications. Today, there is not oral versions of GLP-1 weight loss medications. And, yet some patients are being sold that online and they're just being sold something that is essentially investigational.
So what can people do to make sure that they're using safe forms and maybe some approved treatments?
I think one of the most important things is to get care from a clinician that really cares about you in the long run. This shouldn't be a short-term fix that we're doing. This should be a long-term disease treatment. And talking to your physician, you can go to the Obesity Action Coalition's website. That's www.obesityaction.org. And you can find information about this and about ways that you can connect with a clinician who treats the disease of obesity so you can get access to care.
One more time, finally, where can people go for more information and guidance?
Yeah, well, as I mentioned, they can go to the Obesity Action Coalition. There's also the Obesity Medicine Association, the Obesity Society. There's multiple places where people can go. Our clinic is called Known Well, and we treat patients across the country virtually in 50 states, and we're in person in 6 states across the country. We're not in Florida yet in person, but coming virtually. We're there virtually. So seek out a physician who can see you for the chronic disease of obesity and prescribe an FDA version of these medications.
Dr. Fitch, I want to thank you for joining me today.
Thanks for having me. It was great to be here.
Have you ever noticed how the roads just feel more intense these days? There's new research that's showing nearly all U.S. drivers admit to some form of aggressive driving. Yes, all. So it's everyone's fault. Everything from speeding to cutting people off, and it's one of the big reasons crashes and insurance costs just keep going up. So joining me this morning with insight into what's really happening on the roads and how drivers can protect themselves and their wallets are Ryan McMahon from Cambridge Mobile Telematics and Tamara Johnson from the American Property Casualty Insurance Association. Ryan, Tamara, good morning. Welcome to the show, you two. How are you?
Good morning.
Good morning.
All right, Ryan, why are so many drivers engaging in aggressive driving behavior right now?
Yeah, this is really important here in Florida because there are really not safe drivers, there are safe trips. And you can find yourself, you could be a safe driver every day of the week, and then all of a sudden find yourself in a scenario you didn't expect. And aggressive driving shows up when drivers don't have enough time to react to what's happening around them. The next driver has to react even faster, and that pattern spreads through traffic. And we see it clearly in our analysis of risk. When distraction peaks in the afternoon commute, we see more aggressive reactions, hard braking, hard acceleration, because those drivers don't have enough time to react to the traffic around them. So it's incredibly important to identify and understand that the roads are not as safe as we expect them to be.
Even with some improvements in speeding and distracted driving violations, is aggressive driving still at the heart of today's auto safety problems?
Well, aggressive driving is a big umbrella, and speeding and distraction are really the main contributors to severe crashes. The timing is really important here. Distraction rises in the afternoon. Extreme speeding is most prevalent on late Friday and Saturday nights. Those windows produce the worst outcomes on our roads. So even though risk is trending down a little bit, it's not enough. 34% of crashes here in Florida occur with the driver's phone in their hand at the time of the impact. And those behaviors are affecting all of us, not just those that get into crashes. It does have a lingering effect on risk overall.
Tamara, a lot of drivers say they haven't had a ticket or an accident, so they're confused about the rising insurance premiums. What's behind the increases, and how does aggressive driving really play into that?
Yeah, well, when we look at what we're all paying for auto insurance, it really does boil down to the cost of claims. And so that's why, drivers that may say, hey, I've never even been in an accident, maybe seeing that these auto insurance premiums are going up. It's because that the cost of the things that their auto insurance has to pay for are going up. And that includes things like vehicle repairs and replacement and medical costs. And so, as we have the conversations around aggressive driving, we're really all in this together. When we see more aggression on the road, we see the risk for crashes rise. We see the number of crashes go up. We see more insurance claims being filed. And that really impacts prices for all of us.
So what can consumers actually do to lower their insurance costs?
So they should definitely talk to their insurer, shop around, make sure that they're getting the best policy at the best price. But then there are also things they can do in terms of bundling their auto insurance with other coverage needs like homeowners or renters insurance. And they could also look and see if they could raise their deductible. That could give them some immediate savings on their monthly insurance premium. And then we have these programs, safe driver incentive programs that utilize telematics and also reward safe driving habits. And that can also reduce your premiums. And then if you don't drive that frequently, you can also check and see if there's a pay-as-you-drive policy available to you. So you're not having to pay as much as someone who's on the road a little bit more.
And for anyone that's on the road that wants to dial back their own aggressive driving habits, what are some simple steps that they can take?
Yeah, so it's important that you give yourself enough time to respond. And by avoiding distraction, putting the phone down when you're behind the wheel, you can put your full focus on the road. And so that way, if an emergency does occur in front of you, you are able to respond in enough time where you're not stressed. And then also you need to slow down. Higher speeds increase the severity of crashes, and they make it more likely that someone could be injured or killed. So do some additional planning before you head out the door. Make sure you're giving yourself enough time to get to your destination. And then obviously we're heading into the holidays. We know there's going to be more traffic on the road. Try to be a courteous driver. Remember that your biggest goal is to get home safely. So make sure that you're giving some grace to the other drivers out there.
And finally, where can our audience go for more information about aggressive driving and some other ways that we can save?
Absolutely. Visit us at apci.org/auto for additional information.
I want to thank you two for joining me today.
Absolutely. Thank you.
Thank you.
And until next week, that was Rise Unwind.